The modern healthcare landscape faces an unprecedented crisis of access and efficiency. In major metropolitan areas across the United States, securing a routine primary care appointment can require waiting weeks or even months, while emergency departments overflow with patients seeking care for non-urgent conditions. Against this backdrop of healthcare scarcity, a new generation of artificial intelligence-powered medical platforms has emerged, promising to revolutionize how patients access initial medical guidance and navigate the complex healthcare system. Among these innovative platforms, Doctronic has positioned itself as a particularly ambitious player, claiming to offer something more sophisticated than traditional symptom checkers or basic chatbot interfaces. The company presents its technology not as a single AI system, but as a coordinated team of digital specialists working together to provide comprehensive medical assessments. This multi-agent approach represents a fundamental departure from the simplistic question and answer format that has characterized most consumer health AI tools to date. The vision behind digital medical assistance. Doctronic emerged in 2023 from the collaboration between entrepreneur Matt Pavel and surgeon-scientist Drive Adam Oskovitz, who recognized that traditional healthcare delivery models were failing to meet the immediate needs of millions of patients. Their vision centered on creating a digital front door to healthcare that could provide instant, sophisticated medical guidance while maintaining appropriate safety guardrails and clear pathways to human clinical oversight. The platform they developed offers users a free, anonymous symptom assessment that operates around the clock, requiring no appointment scheduling or insurance verification. Users can describe their symptoms in natural language and receive comprehensive feedback that includes potential diagnoses, plain English explanations of their condition, and specific recommendations for next steps in their care journey. What sets Doctronic apart from other digital health tools is its seamless integration with live clinical services. When the AI assessment suggests that professional medical intervention is warranted, users can immediately connect with licensed healthcare providers through video consultations, typically available within 30 minutes and priced at $39 or the equivalent insurance copayment. This hybrid model addresses one of the fundamental weaknesses of standalone symptom checkers, which often leave users with information but no clear path to treatment. The company's approach has attracted significant investor attention, culminating in a $5 million seed funding round in April 2025 led by Union Square Ventures, with participation from Tusk Ventures and the accelerator HF0. This financial backing reflects growing confidence in AI-powered healthcare solutions and recognition of the substantial market opportunity in addressing healthcare access challenges. The technical architecture, multi-agent intelligence. The core innovation underlying Doctronic lies in its multi-agent architectural approach, which fundamentally differs from single large language model implementations that power most current AI health tools. Rather than relying on a monolithic system to process medical queries, Doctronic employs multiple specialized AI agents, each designed to represent different medical specialties and clinical perspectives. This multi-agent framework operates much like a medical consultation involving multiple specialists. When a user presents symptoms, various AI agents contribute their specialized knowledge and perspectives to the diagnostic process. These agents engage in a form of digital discourse, debating differential diagnoses, weighing evidence, and ultimately reaching consensus on the most likely conditions and appropriate management approaches. The system's architecture is intentionally model agnostic, meaning it can leverage different underlying AI technologies depending on the specific clinical scenario and the strengths of available models. This flexibility allows the platform to optimize performance by selecting the most appropriate AI model for each component of the medical assessment, whether that involves natural language processing, medical reasoning, or clinical decision support. The multi-agent approach provides several theoretical advantages over single model systems. By incorporating multiple perspectives and requiring consensus among agents, the system may be less susceptible to the errors and biases that can affect individual AI models. This collaborative approach mirrors the way complex medical cases are often handled in academic medical centers, where multiple specialists contribute their expertise to develop comprehensive treatment plans. Clinical validation and performance metrics. The most significant validation of Doctronic's approach comes from a comprehensive retrospective study published in mid-2025, which represents one of the most rigorous real-world evaluations of AI diagnostic performance to date. This study analyzed 500 consecutive virtual urgent care encounters, comparing the platform's AI-generated diagnoses and treatment recommendations with those made by board-certified healthcare providers. The results of this analysis were striking in their demonstration of AI-human clinical concordance. In 81% of cases, the AI system's primary diagnosis matched the diagnosis reached by human clinicians treating the same patients. Even more remarkably, the treatment plans generated by the AI system showed concordance with human-generated plans in over 99% of cases, suggesting that the AI was not only reaching similar diagnostic conclusions but was also recommending appropriate therapeutic interventions. Perhaps most intriguingly, when clinical experts reviewed cases where the AI and human providers disagreed, they judged the AI's performance to be superior in more than one-third of discordant cases, compared to less than 10% where human performance was deemed superior. This finding suggests that AI systems may, in some circumstances, provide clinical insights that complement or even exceed traditional human clinical reasoning. However, the researchers appropriately emphasized important limitations in interpreting these results. The study measured concordance rather than ultimate clinical outcomes, meaning it demonstrated agreement between AI and human providers rather than proving that either approach led to better patient outcomes. Additionally, the study design potentially introduced anchoring bias, as human clinicians could review the AI-generated notes before making their own clinical decisions, potentially influencing their reasoning toward alignment with the AI recommendations. User experience and market reception. The practical implementation of Doctronic's technology has generated considerable user interest, with the company reporting millions of AI consultations conducted through their platform and approximately 50,000 weekly users. These usage metrics, while representing marketing claims rather than independently verified statistics, suggest substantial consumer demand for accessible AI-powered medical guidance. User feedback reveals a mixed but generally positive reception of the platform's capabilities. Many users praise the system's speed, convenience, and affordability, particularly those who lack comprehensive health insurance coverage or face long wait times for traditional medical appointments. The ability to receive immediate medical guidance without scheduling appointments or navigating complex healthcare bureaucracies represents a significant value proposition for many consumers. However, user experiences also highlight important limitations and areas for improvement. Some users have reported technical issues including system delays, broken links, and difficulties transitioning between the AI assessment and human clinical consultations. More concerning are reports of potential safety issues, such as instances where the AI system appeared to recommend medications that users had previously indicated as allergies. These mixed user experiences underscore the inherent challenges in deploying AI medical systems at scale while maintaining both performance and safety standards. They also reinforce the importance of the platform's explicit disclaimers stating that the AI guidance should be discussed with licensed healthcare providers rather than being treated as definitive medical advice. Privacy, security, and regulatory considerations. In the healthcare technology sector, privacy and regulatory compliance represent critical success factors that can determine whether innovative platforms achieve widespread adoption or face regulatory obstacles. Doctronic has positioned itself as fully compliant with Health Insurance Portability and Accountability Act requirements, emphasizing anonymous usage by default and implementing comprehensive data protection measures. The company's privacy approach includes end-to-end encryption, strict access controls, detailed audit logging, and user-controlled data deletion capabilities. By making anonymous usage the default option, the platform reduces privacy risks while still allowing users who choose to create accounts to save their medical histories and benefit from personalized recommendations over time. From a regulatory perspective, Doctronic has adopted a cautious approach by explicitly disclaiming that its AI system constitutes the practice of medicine or provides medical advice in the regulatory sense. This positioning helps the company navigate the current regulatory environment, where AI medical devices face complex approval processes and ongoing scrutiny from healthcare regulators. The company's terms of service and user interface consistently emphasize that the platform provides informational guidance rather than medical diagnosis or treatment, and that users should discuss AI-generated recommendations with licensed healthcare providers. This approach reflects the current regulatory reality where consumer-facing AI health tools must carefully distinguish between providing medical information and practicing medicine. Economic model and healthcare access. Doctronic's pricing structure reflects a deliberate strategy to lower barriers to healthcare access while maintaining financial sustainability. The core AI symptom assessment remains free and anonymous, removing traditional obstacles such as insurance verification, appointment scheduling, or upfront payment requirements. This approach makes initial medical guidance accessible to uninsured individuals, those with high deductible health plans, and anyone seeking immediate medical information outside normal healthcare operating hours. When professional medical consultation is recommended, the platform offers video visits with licensed providers at a flat rate of $39 or the user's insurance copayment, whichever is lower. This transparent pricing model compares favorably to many urgent care centers, emergency department visits, or specialty consultations, particularly for users without comprehensive insurance coverage. The company also offers an optional premium membership for $5 per month, which provides enhanced features including longer message capabilities, file uploads, saved conversation history, and persistent personalization across sessions. This tiered approach allows casual users to access basic services at no cost while providing additional revenue from users who require more comprehensive features. This economic model addresses several fundamental problems in contemporary healthcare delivery. For many patients, the primary barrier to receiving appropriate medical care is not the sophistication of available treatments, but rather the difficulty of accessing initial clinical guidance and navigation support. By providing immediate, low-cost access to medical assessment and clear pathways to professional treatment, platforms like Doctronic may help reduce inappropriate emergency department utilization while improving overall healthcare efficiency. Comparative analysis and market position. The digital health landscape includes numerous companies attempting to leverage artificial intelligence for medical applications, ranging from symptom checkers and diagnostic support tools to comprehensive telemedicine platforms. Within this competitive environment, Doctronic's multi-agent architecture and integrated clinical handoff represent distinctive positioning elements that differentiate it from both traditional symptom checkers and standalone telemedicine services. Traditional symptom checkers, which have been available for over a decade, typically provide static decision trees or simple AI-powered assessments that generate lists of possible conditions but offer limited guidance on appropriate next steps. These tools often leave users with information but no clear pathway to treatment, creating a gap between initial assessment and actual medical care. Conversely, traditional telemedicine platforms focus primarily on connecting patients with healthcare providers through video consultations but provide limited preliminary assessment or triage capabilities. Patients using these services must typically schedule appointments and describe their symptoms directly to clinicians without the benefit of structured preliminary evaluation. Doctronic's hybrid approach attempts to combine the immediate accessibility of symptom checkers with the clinical expertise of telemedicine consultations, while adding the sophisticated reasoning capabilities of multi-agent AI systems. This integrated approach could potentially provide superior user experiences by offering both immediate guidance and seamless access to professional medical care when needed. Challenges and limitations. Despite promising early results and growing user adoption, Doctronic faces several significant challenges that could impact its long-term success and clinical utility. The fundamental challenge facing all AI medical systems involves the tension between accessibility and safety, particularly when serving diverse patient populations with varying levels of health literacy and complex medical histories. The current evidence base, while encouraging, remains limited in several important respects. The published clinical validation study, despite its impressive scope, measured agreement between AI and human providers rather than actual patient outcomes. This distinction is crucial because concordance does not necessarily translate to improved clinical results, patient satisfaction, or cost-effectiveness. Future research must address whether AI-guided care actually leads to better health outcomes compared to traditional care delivery models. The study's design also introduced potential biases that could inflate apparent AI performance. When human clinicians can review AI-generated assessments before making their own clinical decisions, their reasoning may be influenced toward alignment with the AI recommendations, artificially increasing measured concordance. Understanding the true comparative performance of AI and human clinical reasoning requires study designs that prevent such cross-contamination of decision-making processes. Another significant limitation involves the generalizability of current evidence. The The existing research focuses primarily on English-speaking patients in United States urgent care settings, leaving important questions about performance across different languages, cultural contexts, healthcare systems, and patient populations. The patients who might benefit most from improved healthcare access, including those with limited English proficiency, complex medical histories, or multiple chronic conditions, remain understudied in current AI medical research. Technical reliability represents another ongoing challenge. User reports of missed allergy information, generic recommendations that fail to account for individual patient factors, and occasional system malfunctions highlight the difficulties of maintaining consistent performance across diverse clinical scenarios. These reliability concerns are particularly problematic in medical applications where errors can have serious clinical consequences. Future implications and healthcare transformation. The emergence of sophisticated AI medical platforms like Doctronic represents a broader transformation in healthcare delivery that could fundamentally alter how patients access and receive medical care. If these systems continue to demonstrate clinical effectiveness while maintaining appropriate safety standards, they could become standard components of healthcare infrastructure, serving as intelligent triage systems that improve efficiency across the entire healthcare ecosystem. The potential benefits of widespread AI medical assistance extend beyond individual patient convenience to include systemic improvements in healthcare resource allocation. By providing accurate initial assessments and appropriate care guidance, these systems could reduce unnecessary emergency department visits, improve the efficiency of primary care practices, and help patients receive appropriate care in the most suitable settings. However, realizing these potential benefits requires addressing current limitations through continued research, technological development, and regulatory refinement. The healthcare technology sector must invest in long-term outcome studies that demonstrate not just AI-human concordance, but actual improvements in patient health, satisfaction, and cost-effectiveness. The regulatory environment will also need to evolve to accommodate the unique characteristics of AI medical systems while maintaining appropriate patient protections. Current regulatory frameworks, designed primarily for traditional medical devices and pharmaceuticals, may not adequately address the dynamic, learning-based nature of AI systems or the novel questions they raise about medical practice and patient safety. Conclusion: promise and prudence in AI healthcare. Doctronic represents a compelling example of how artificial intelligence might transform healthcare access and delivery, combining sophisticated multi-agent reasoning with practical clinical integration and transparent business models. The company's early clinical validation results are encouraging, suggesting that AI systems can achieve substantial concordance with human clinical reasoning in real-world healthcare settings. However, the current state of evidence demands cautious interpretation and continued rigorous evaluation. While AI medical systems like Doctronic show promise as tools for improving healthcare access and efficiency, they remain supplements to rather than replacements for human clinical judgment. The most appropriate current role for these systems involves serving as intelligent triage and navigation tools that help patients understand their symptoms, assess urgency levels, and connect with appropriate clinical care when needed. The success of AI medical platforms will ultimately depend on their ability to demonstrate meaningful improvements in patient outcomes while maintaining safety standards and earning the trust of both patients and healthcare providers. As the technology continues to evolve and the evidence base expands, these systems may indeed fulfill their promise of making quality medical guidance more accessible, affordable, and immediately available to patients worldwide. The healthcare transformation enabled by AI medical assistance represents both tremendous opportunity and significant responsibility. By approaching this technology with appropriate enthusiasm tempered by rigorous evaluation and continuous attention to patient safety, the medical community can harness the potential of artificial intelligence to address long-standing challenges in healthcare access while preserving the human clinical expertise that remains essential for optimal patient care.